So what we should do next? What is your suggestions, doctors? Okay, breast cancer. Yeah, doctor, lung nodule and lung cancer is a different thing, but I have never seen that lung nodules part has came in the AMC because usually they are mainly focused on lung cancer. I know you are talking about that huge chart in lung nodules, right? I know I also uh, have a note for that as well, but it's different, doctor. The lung nodule part, it's a very huge part, right? The huge chart and everything. Okay, if you have time, you can give it to read, but it's not very important like the lung cancer part. Yeah, I know, doctor, but don't be bothered. But usually they are giving from the lung cancer. If we get some questions in the future, then we will go through it. Otherwise, we will stick to the main screening part, right? The main cancers that we should go with as a screening. Okay, so let's discuss about the breast cancer screening. Okay, let's go through breast cancer. Okay, here. So, uh, here also we have to categorize these patients according to their risk factors, right? According to risk factors. So, let's go through it. Yeah. First of all, we have to categorize these patients. So, who are the average risk and moderate risk and high risk? Okay, so we have to categorize. First, 1 minute. Okay, let's go by. First, start from the average risk patients. So, who are the average risk patients? Here, average risk patient also no confirmed family history. So, in as in colorectal cancer, also they have mentioned no confirmed family history, right? Here also in average category, first thing is no confirmed family history of breast cancer, or one first degree relative diagnosed with breast cancer at age of 50 or more than 50 years. So what is the number in breast cancer? It's 50. So in colorectal cancer, it's 60. So you have to remember. If you're like familiar with these guidelines, this screening part, you can easily, like both are same, right? Even colorectal and breast cancer, the average category here, the more only thing difference is here more than 50. Kind of same, not everything, but they have some similar features. Here, age of 50 or more than 50 years. Or one second degree relative diagnosed with breast cancer at any age. Or two second degree relatives on the same side of the family diagnosed with the breast cancer at age in 50 or more than 50 years. Then next one is two first or second degree relatives diagnosed with breast cancer at age 50 or more than 50, but on different sides. Okay, different sides of the family, maternal mother's side and father's. Okay, so these are the criteria. You have to write down each and everything. Then you have to remember these things. Okay, yeah. So those are the average risk. So who are the moderate risk? Moderate risk people. These are one first degree relative diagnosed with breast cancer at age less than 50 years, Okay, less than 50 years, without the additional features of the potentially high risk group. We'll discuss. Yes, for now, remember, patient is less than 50 years. Okay, patient is less than 50 years. In this case, first degree relative or two first degree relatives on same side of the family diagnosed with breast cancer. Okay. So second one is two first degree relatives on the same side of the family diagnosed with breast cancer. Then third category, the third one, two second degree relatives on the same side of the family diagnosed with breast cancer, at least one at age of less than 50 years. Okay, please remember. Yeah, that's all for the moderate risk. Then who are the high risk? High risk, okay. So these are the high risk features that they have mentioned without the additional features of the potentially high risk group. So this is the high risk group. So in high risk group, who are the risk people? Two first or second degree relatives, okay, who two first or second degree relatives on the one side of the family diagnosed with breast or ovarian cancer. Here, O, okay, breast or ovarian cancer plus one or more of the following features in the same side of the family. So, what are these other features? Additional relative with breast or ovarian cancer, then breast cancer diagnosed age before for age 40 years, before age of 40, or bilateral breast cancer, breast and ovarian cancer in the woman in same woman, and Ashkenazi Jewish ancestry people, usually Jewish people, and breast cancer in male relatives. So I know this feel like hard, right? But if in the STEM, like when we have a general idea with like these male male one, like male with breast cancer or additional ovarian and breast cancer in the same person, and what are the Jewish people? So these are the risk factors, and two first or second degree relatives, so you can easily diagnose them as the high risk category, right? So you don't have to like remember word by word, just keep a general idea, okay? Just keep a general idea, then you will find it. Yeah. And member of family in which the presence of high risk breast cancer gene mutations, BRCA1 and 2. Okay, so these are the high risk. And here, Australian National Breast Cancer Screening Program for focus on the age, inviting all the women aged between 50 and till 74 years for biennial mammographic screening. Okay, please remember from 50 start it, and women are able to self-refer for mammographic screening in breast screen from age 40. Okay, but usual the annual Australian program starting from 50. But if these people want this mammography and they need to screen for the breast cancer, they can do it from the age 40. Okay, then yeah. Okay, let's go back to the this risk and what we should do. In here, women at average risk or slightly higher than average risk of breast cancer should participate in mammographic screening program from 50 to 74 years as the part of national breast screening program. Okay, then we have to do the mammogram every 2 yearly. Mhm. Then, a screening by mammography is not recommended in women aged more than or equal to 75 due to the insufficient evidence to assess the balance of benefit and harm. Then, clinical breast examination for breast cancer screening of average risk women in general practice is not recommended. Okay. Then, do not use MRI as the standard alone screening test for average risk patient, and do not use thermography in breast cancer screening or as an adjunctive tool to mammography. So you should know for the average risk we have to start from the 50 years of the age, mammography every 2 years, right? That's for average. Then what for moderate risk people? Undertake mammographic screening from age 40. You have to remember, okay? Age 40. Sorry. Age 40 to 74 years for women, moderately increased risk. So, for the moderate one, we have to start from 40. For average one, we have to start from 50. And here, how often we should do the mammograph? At least every 2 years. At least, okay? At least every 2 years. I'll show one more thing, okay? Remember for now this at least, the word at least, remember every 2 years. Then and counsel all the women that follow the associated low breast cancer risk, physical activity, maintenance, normal BMI, minimize alcohol, and having children and breastfeed. And it is recommended that all women, whether or not they undergo mammographic screening, are aware of how their breasts normally look and feel. Okay, we have to advise these patients if there is any lump or breast changes, nipple discharge, or change in skin color. We have to advise about these things because this can be a signs of cancer, right? So we have to advise patients to meet the GP if they find out these symptoms. And yeah, and they have mentioned something here. Okay. For It's equity. It same thing as that part. Okay, specific population. So for women at potential high risk of carrying a mutation, the high risk group, offer referral to a family cancer clinic for risk assessment, possible genetic testing, and risk reduction in management plan. Okay, management plan and individualized surveillance and risk reduction plan, including consideration of associated risk for the cancer, may include. In these patients, a regular clinical breast examination and annual breast imaging with mammography, MRI, or ultrasound. So, in high risk patients, they have individualized surveillance plan, right? Individualized plan. So, if they ask, so how often we should do the mammography, you have to remember about annual. Okay, here they have mentioned we can do the annual breast imaging with mammography, MRI, or ultrasound. Okay, please remember this. Then, chemo prevention with the selective estrogen receptor modulators like tamoxifen or raloxifene or aromatase inhibitors or mastectomy and sulforectomy. So in here, the screening part, you have to remember what are the three categories of risk and what we should do for the average. Every 2 yearly, we have to do the mammogram starting from age 50. For the moderate risk, we have to do the mammogram at least 2 years starting from age 40. And for the potentially high risk patients, it's an individualized plan. But if they ask how often do the mammogram or the imaging, you have to mark it as the annual. Here they have mentioned annual breast imaging. And we have to follow other interventions as is because they have other cancers and they are very high risk population. Okay, so that's all for breast cancer. And let's check about it.
And the last one was which document?
The same one, doctor. Yeah, the same red book guideline. No, not this one. Here, the same guideline, doctor, the red book. Okay, you can find in here the breast cancer. We have discussed from here. Here, the breast cancer. Okay,
Okay, okay, ma'am. Thank you. Thank
okay. So let's. Okay, we got three questions. Let's do one by one. A 42-year-old woman presented to a GP clinic about her risk of breast cancer. She has not had any recent weight loss or fever and has no changes to her menstrual period. She has never had mammogram. She performed breast self-examination monthly and has never detected any anomaly. She has no significant medical history and she has a mirena in situ for the contraception and take no regular medications, and she has two children, the first of which conceived at the age of 30. Her mother was that sorry doctors. The mother was diagnosed with the breast cancer at the age of 40 years. Her paternal aunt was diagnosed with breast cancer at the age of 60. So, which one of the following screening regime is most appropriate? What is this? What do you think? So, type your answers in the chat. So, what do you think? Mm-hmm. Yeah, let's check.
you. B.
Yeah, in here they have mentioned the same thing. Okay, at least every 2 years from the age 40 to 74. However, annual mammogram may be recommended. Okay, because they mention at least every 2 years. So, best annual mammogram. Okay, so please remember, even though they haven't mentioned in this guideline, they have mentioned at least two, right? Sorry, at least. Where's that? I want to show you. Yeah, at least every 2 years. Okay, at least every 2 years. But best, please make a note here. Best to do it annually. Okay, make a note here. Best to do it annually. Yeah. Okay. So the next question. A 76-year-old woman present to the GP clinic for the routine health check, and she has a medical history of MI 12 months ago, requiring coronary artery stent placement. Her regular medications include perindopril, metformin, aspirin, and clopidogrel. She has been having regular 2 yearly screening mammogram since age 55 with no abnormal finding. She has no personal or family history of breast cancer. She asks if she need to continue with the mammographic screening as she find the procedure uncomfortable. On examination, appear well with normal vital signs, and breast examination reveal no palpable abnormalities. So, which one of the following regarding screening? What do you think, doctors? Okay, we got C's. Okay, let's check. I don't know what happened to my medicine here. Minute. What is happening, doctor? You can hear me, right? Image is like okay. It's not working. I don't know why. Because we have more questions as well. Okay, fine. Finally. Yeah, okay. Here, our patient is in 74, I sorry, 76 year. So we don't need further cancer screening, right? Because it's 50 to 74. And but still we can give some advices about this cancer screening, like if there's any breast changes or if there is any discharge, any skin changes. So, and if they find out something like that, they have to consult their GP, right? Yeah, yeah, that's all. And after age 74, women may continue screening if they choose, but are no longer actively invited. Okay, 47-year-old old woman is being screened for breast cancer. Information is being sought from her family history to assess likelihood of BRCA mutation. Which one of the following family history would pose the greatest possibility of the presence of BRCA mutation? So, what do you think? Type your answers in the chat. What do you think? Okay. Okay, most of doctors are going with A. Let's see. Good. You understand everything, right? Yeah. So here, presence of BRC mutation is often suggested by family history of breast and ovarian cancer, particularly when these cancers occurs at young age. In this scenario, the combination of mother with ovarian cancer, sister with early onset breast cancer is highly suggestive of BRCA mutation. This is because BRCA mutation are strongly associated with both breast and ovarian cancer. Right? Yeah. I think that's all for yeah. That's all for the breast cancer. Right?